Hello and welcome to today's episode of Health University, where I have the pleasure of speaking today with Dr. Jenn Simmons. Dr. Jenn is on a mission to change the impact of breast cancer by empowering women to take control of their health and to create the life they want to live. She hosts her own weekly podcast, Keeping Abreast with Dr. Jenn, and she's hosted the Breast Cancer Breakthrough Summit. Finally, and most importantly, because I love this book, she's the author of the recently released The Smart Woman's Guide to Breast Cancer, something that everyone should be picking up. And of course, links will be in the show notes below. Dr. Jenn is also currently opening across the country. It's called Perfection Imaging. And these centers feature an innovative technology using sound waves to create 3D reconstruction of the breast without pain, compression, and most importantly, radiation. Yeah. This fast, affordable, and FDA-approved technology has 40 times the resolution of an MRI and will forever change the way we screen for breast cancer. So welcome, Dr. Jenn, and thank you so much for being here today. It's really a delight to have you.
Thank you. I'm so happy to be here.
Thank you. So before we begin, I wanted to invite you, if you wouldn't mind, describing your story. Like, how did you come to be the breast cancer warrior, if you will?
Yeah. So like everyone else, I have a pain to purpose story, but my pain came long after my purpose. So I grew up in a family that nearly every woman had breast cancer. And there really wasn't a time in my life where I don't remember knowing about breast cancer. It was absolutely positively part of the fabric of our family. When I was a young girl, I had a first cousin. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. I'm really going to date myself now. And she wrote all the music for the Spinners and the Stylistics.
Oh, wow.
She was the queen of See, now you get it.
I do.
Right?
Oh,
there
I
are a
just got
lot of
chills.
people when I
Yeah.
say that, and they're like, oh, great. Who?
No. Oh,
What?
wow.
Yeah. She was the queen of Motown Sound in Philadelphia. She was beautiful, brilliant, larger than life. She lit up a room, and she wrote 54 hits.
Wow.
And her most famous song was The Greatest Love of All.
Seriously?
Yeah.
Oh my God, I could get teary. This is
Yeah.
so beautiful. And I'm cringing at where this is going.
Yeah, she was my hero.
Yeah,
and she was quite a hero. And so she wrote that song in 1977 as the title track to the movie The Greatest, starring Muhammad Ali. But it really received its acclaim in March of 1986 when Whitney Houston released that song to the world.
Yeah.
And at that time, it would spend 14 weeks at the top of the charts. Only Linda would never know. Because Linda died of metastatic breast cancer just 1 month after Whitney released that song.
Honey, I'm so sorry. Like, that's tragic.
I was 16 years old when my hero died. And I still can't tell the story without tears coming to my eyes. I remember it like it was yesterday.
Right. Because she was your greatest love of all.
Yeah.
Yeah.
And her life and ultimately her death gave birth to my life's purpose.
Amazing.
Because I never wanted another woman, another family, another community to have to suffer like that. And so I did the only thing I knew how to do. I became a doctor.
Yeah.
I was the first doctor in my family. I became a surgeon. I became the first fellowship-trained breast surgeon in Philadelphia. And I was one of the best breast doctors there was for a very long time. And I remember my first year as a surgical resident. You call it your intern year. And I'm in a surgical program there were 40 surgical residents, 3 of which were women. We were few and far between. And in the very beginning of my intern year, one of the physicians on staff who was a woman, and there were few and far between of those, of the 100 surgeons that they had on staff, 3 of them were women. So she took me out to dinner one night in the very beginning, and I saw her as having it all. And I said, how do you do it? How do you do it? You're beautiful and you're brilliant and you have this practice and this amazing following and this amazing family. And how do you do it? And she said, Jen, you can have it all too, but you can't have it all at once.
Ah, beautiful.
And you're never going to be the greatest doctor, and at the same time, the greatest wife, and at the
Mhm.
same time, the greatest mother, and at the same time, the greatest athlete, and the
Mm.
greatest philanthropist, and all of those things. When you're 20 some years old and those words are coming at you, they don't mean anything.
Yeah. Yeah.
Okay, maybe you can't, but I
Right.
can have it
Where
all.
they get the response, watch me now.
Yeah, watch me now. That's exactly right. And so I was on a watch me now vision where I was
Mm,
going to have it all.
mm,
And so I'm running the breast cancer program for my hospital. I'm running the cancer program in general for my hospital. And I'm a wife and a mother and a stepmother and an athlete and a philanthropist. And I have all of these balls in the air. And I'm writing articles and papers and doing all the things and think that I'm an expert juggler
mhm.
until the day that all came crashing down for me. And I went from being one of the highest performing people that you probably have ever known to I couldn't walk across the room because I didn't have the breath in my body.
Oh, goodness.
And I spent 3 days in a very intensive workup because when your prize pony is hurt, you figure out what's wrong with that prize pony pretty fast.
Mhm.
And at the end of that 3 days, I'm sitting in the office of my friend and colleague and physician. And he tells me that I need surgery
Mm.
and chemo radiation. And I appreciate the irony. I get it.
Yeah.
I know that these are things that I say all day, every day without hesitation or reservation. But when these words are coming at you, it's a different ballgame, sister.
Of course. That takes your breath
And
away.
yeah, for sure. And all I could think about in that time and space is that there has to be a better way.
Yeah.
And I never before thought about that.
Yeah.
In the thousands and thousands of surgeries that I had done,
Mhm.
in the thousands and thousands of women who I ushered through their breast cancer diagnosis,
Mhm.
never did I think there's got to be a better way.
Mhm.
But somehow, when it's coming at you,
Yeah.
is this really all there is? Is
Mhm.
this everything? And I walked out of the office that day. I refused treatment.
You did.
My doctor told me the same thing that I had told all the women before, that I will die of my disease if I don't treat it. But something told me that there's something more, and I went on a quest to find it.
That's beautiful.
It
Well,
was very selfish. So, this wasn't about how am I going to get everyone else better? This was
mhm.
about how am I going to get better so I can continue to serve?
Mhm. Well, that's not selfish. That's self first, but that's not selfish.
Yeah,
Mhm.
yeah.
Mhm.
And I honestly think that that's a page that everyone needs to put in their own book.
Absolutely.
Because if you don't put your oxygen mask on first, you cannot be of service to others.
Mhm.
But in that moment, I was honestly thinking, I need to figure out how I get better because my boys are young and they need
Yeah.
me.
Yeah.
And I have to be here for them. And I
Mhm.
have to be here for my husband. And I have to
Mhm.
be here for my patients.
Mhm.
So I went on this journey and I was very fortunate. Although I want to tell you that the struggle is real and it's a lot different telling the story from this side because I can fast forward and say, I got better,
Yeah.
right? It took me 3 years and I
Wow.
got a lot worse before I got better. So
Mhm.
I don't recommend taking this trip alone,
Mhm.
but that I was very fortunate that very early on in that journey, I had the opportunity to listen to a gentleman speak. So I'm sitting in a lecture hall, and this tall, lanky guy walks on stage with his big, toothy grin, and he
Mhm.
introduces himself as a functional medicine physician. Now,
Mhm.
at this point, I had been a physician for about 20 years,
Mhm.
very conventionally trained, went to one of the top medical schools in the country. I I was not yet drinking the proverbial Kool-Aid.
You had earned your stripes and you are captain here.
Yeah.
Mhm. Mhm.
And so I sat there thinking, there's no such thing as a functional medicine physician. So what is this quack talking about? And then I remembered that I was sick and I was there
Mhm.
for a reason. So I
Uh-huh.
checked my ego at the door, tune in, and thank God I did.
Beautiful. Because I was
Because
going to suggest possibly, of course, one will never know, but that very rigid point of view due to the decades of training and that is part of what got you very sick and had to get unwound.
100% that's what
Hmm.
bought me the seat at the stadium,
Hmm.
right?
Hmm.
That's why I was in that seat.
Yeah. Yeah.
And so it turns out that man, that quack, was Mark Hyman.
Oh. Oh, who
But
said I've not heard that name before?
but this was 2016.
Yeah.
And in 2016, it's really reasonable to think that you wouldn't have heard that name.
Yeah.
Like, even,
Yeah.
I think there are even people now who don't know that name.
Well,
And with
if you
those
haven't heard
people,
that name, people, I really encourage you to Google
for
info.
me, those are the really like lost lambs.
Yeah.
Those are the people that are so still stuck in that conventional
Mhm.
medical world. And when
Mhm.
I say stuck in the conventional medical world, if you still think that is all there is, you're
Mhm.
really lost
Mhm.
because
Mhm.
there's so much chatter out there that
Mhm.
there's more that you should have heard it by now.
Right.
And
And by
so,
lost, possibly again, closed-minded, because
mhm,
as you say, in 2016, it was a newfangled way of
yeah,
approaching medicine.
yeah,
But by 2024, we see functional medicine everywhere across social
yeah.
media and so forth. And tell us, if you don't mind, the listeners, how would you describe functional medicine, especially as it
Yeah.
pertains to breast health?
Yeah. So I'm going to first say that in the conventional medical space, we don't measure health, we measure illness.
Hmm.
And the only way to get into the conventional medical space is to fail,
Hmm.
right?
Yeah.
Think about what happens when you go to your doctor and you say, first of all, no one goes to their doctor, their conventional medical doctor, and says, I want to feel amazing. How do I do that?
Hmm.
Because that conventional medical doctor has no idea how to answer that question. So, why do we go to the conventional medical doctor when we don't feel amazing, when
Hmm.
we're tired, when we're sad, when we're depressed, when we're not sleeping, when we don't have energy, when we have palpitations, when we have this, when we have that? Like, we're always going
Right.
because we're failing. And most of the time, the response that you get from that conventional medical doctor is, you're not bad enough, right? Your
Mm.
labs are
Mm.
fine. You're on the
Mm.
line of fine.
Hmm.
And they measure some pretty basic, typical labs. And when they interpret said labs, they are using a scale that includes 95% of the population. Now, is 95% of the population healthy? No,
Of
not even
course not.
close.
No, no.
But that's the line of fine that we're using right now.
Mhm.
So, in functional medicine, we look to help people to function optimally. So, we're not interested in the person that is falling within that 95% confidence interval. We are looking for you to have ideal function. And
Mhm.
ideal function means that when we look at your labs, we want them to be optimal.
Yeah.
When we look at your diet, we want to optimize it for you. When we look at your movement routine, we want to optimize it for you. When we look at your sleep, we want to make sure that's happening in the way that is restorative and nourishing. And we're
Mhm.
looking at all these different pillars that we know drive health
Mhm.
and making sure that they are firmly implanted in place. And we're figuring out what are those things that might be interfering with your optimal function.
Yeah.
But that to me is what functional medicine is. It's
Right.
helping you to function optimally so that you can live as long as possible and die young,
Yeah.
because that's what we should all be aiming for.
Right.
That should be all of our North Star, to
Mhm.
live as long as possible and to die young. And I'll take a page out of our mutual mentor, Jay Virgin's book,
Mhm.
when she says that she wants to be relevant at 100.
Yeah.
And in order to do that, you really have to be alive with your finger on the pulse.
Starting now.
Starting now. For everyone, no matter where you are. I don't care if
Exactly.
you're 30, you just start now. 40, start now. 50, start now.
Yep.
And at any age and at any stage, you can be healthy. But health is something that is a constant effort.
Right.
It's not like you get there and you like, okay, been there, done that. It's not the marathon that you ran, right? It's not something that you check off your list.
It is a
This is
dynamic exercise, a relationship actually with your life. It's so funny because as you were ticking off these things, of course, I'm a doctor of Chinese medicine, and I'm saying, of course, because that's how we view through our filter of Chinese medicine, we are doing functional medicine. We're not looking, well, I will look at the labs because I've got functional medicine in my pocket as well, but it's not the traditional Chinese medicine way. But it is lifestyle medicine. It is seeing where patterns go out of balance and then doing what needs to be done to get them back into balance, optimized.
Yeah. And so you might not be looking at labs, but you are certainly looking at function.
Absolutely. Yeah.
And there are always metrics that you can measure. You're measuring pulses, you're measuring energy. All of us have our way of assessing where are you in terms of optimal function.
Right. And in my little niche, I actually do use labs because, again, the IVF the person going through IVF, labs are imperative. And that's, if I may, I want to jump to labs are imperative. Again, especially insofar as breast health is concerned, hormonal health and breast health. Let's pivot there if you don't mind.
I don't mind at all. So I say the same thing about breast health that I say about fertility, in that breast health is health. And the same things that are going to give you healthy breasts are going to give you a healthy brain, a healthy heart, healthy bones, healthy joint, healthy skin, healthy immune system, healthy endocrine system, healthy, right? Breast health is health. That same very thing is true of fertility.
Yeah.
Fertility is health.
Right. I say the same thing. Your whole health is your fertile health. Your fertile health is your whole health. There, you don't take off this little section and say, how are the ovaries doing?
Yeah.
Possibly for a particular treatment, but that's not health.
And we're all a symphony playing at every time, every moment. We're a symphony that's playing. And so if one of the instrument sections is off, that's going to affect our symphony. And so we always want to know that we are playing in concert with one another. And there's no way to have a beautiful symphony if the gut section is off. Like, it's not happening. And I could say that about almost every system, but it still traces back to, are you inherently healthy? And if you're not, let's figure out why. What is your impediment to health? What is in your way? What is blocking you? And that's Chinese medicine talks about that all the time.
Yes,
right? What is blocking you? And then, so what do you have that you don't need? And what do you need that you don't have?
Absolutely. And we actually say there's a line in the ancient medical text that speaks to the gut, in that they will say everything, we use the term postnatal chi, derives from, we refer to the gut as the spleen. Now we talk about it as the microbiome, right? It is the master conductor of this symphony. If your gut is off, the entire hormonal chain will be off.
You can't have hormonal health in a vacuum. And our conventional medical system really did such a huge disservice along the way, because what's the earliest indication that we don't have hormonal health? We have these young girls with menstrual irregularities. And instead of taking the moments that you need to take to ask the questions why, to figure out what's going on, to figure out why this isn't happening in the way that it's supposed to happen, we're bullies.
We put them on
We're just going to take it over. We're going to put you on birth control pills.
Mhm.
And you kick the can down the
For
road.
25 years.
Yeah. Yeah.
Because
You
sometimes
kick the can down the road.
Yeah.
So those young girls that could have had the opportunity then to figure out how to come into hormone balance, because spoiler alert, we're supposed to menstruate. That means that we're working properly and we're supposed to menstruate regularly. That means that we're working properly, but no one wants to take the time to deal with it. So they put them on birth control pills. And also, at this point, they just don't have the education to deal with it.
Exactly. But however, they're capable. These young girls are capable of learning about their own bodies. And I will say there are women who are coming in and sitting across from me in their late 30s, early 40s, top of the world CEOs who will sit and say, how do I not know this about my own body? Brilliant people.
Yeah, but
And
their
my answer is,
doctors don't even know it. They just don't have, it starts at the curriculum with which we train our providers.
Yeah.
The providers are not trained. They're not. And we think about the arena like we think of OBGYNs as hormone experts. But as our mutual friend Tabitha Barber points out, OBGYNs are surgeons.
Yeah.
They're trained to be surgeons. They are not trained to be hormone experts. And the fact that the organs that they deal with the most, which are the reproductive organs, does not make them hormone experts. They're just simply not taught. And then the other downfall of our system, because it's so segregated, right? Like, I'm going to handle this part, you handle this part, that one's going to handle that part. So because the OBGYNs deal with reproduction and reproductive organs and reproductive health, the endocrinologists have ignored that part of it. Like, oh, the OBGYNs have that handled, so I'm not really going to focus on that too much. I'll learn what I need to know about the thyroid and the adrenals and the pituitary, and I'm going to leave the rest of it up to the OBGYN. So it's this one thinks that one has it, that one thinks this one has it, and actually no one has it. That is a ball that was dropped.
Yeah.
And because
I'll give a
they
shout out to the reproductive endocrinologists, because the IVF docs who are because they are trained in this.
But that's a whole fellowship in and of itself.
Exactly. And it's not one that most of us want to have to find ourselves in front of, because that means something's gone way down the road sideways.
But most people, so the 13-year-old, 14-year-old, 15-year-old, 16-year-old, 17-year-old with irregular periods, heavy periods, acne, symptoms of PCOS, they are not getting referred to the reproductive endocrinologists who know and understand hormone imbalance. They are getting put on birth control pills.
You're absolutely right.
And that can is getting, so it's not like we're not utilizing the right players for that time in the game.
Yeah, absolutely.
Yeah, because the only people that are getting referred to the reproductive endocrinologists are the people who are having problems with fertility, even though technically that 13, 14, 15, 16, 17-year-old who is having menstrual irregularity, they're having problems with infertility.
Exactly.
They just don't know it yet.
Exactly. It's not relevant to them yet. But your point is so well taken. And this is exactly what the conversation we need to have in the medical community at large, but thankfully on this podcast today.
Yeah. And it's just, people don't realize it, but it's the same people that wind up in your office in their 30s and 40s that wind up in my office in their 40s and 50s because no one dealt with the issue when they were 13 and 14.
Oh, it makes me teary.
Yeah. And so what we really need is basic education. And what you and I are doing is we're educating the public.
Yeah.
Because it's for us to educate the doctors, that's a whole other job.
Right.
That I'm not willing or wanting to take on.
Mm-hmm.
I don't know, maybe you're willing and wanting to take it on.
I don't think that they are willing or wanting to have it
Yeah,
taken on, because here again, back to your prior conversation when you sat in that stadium and in 2016 and felt like, I don't need to know this. And no disrespect, they too are coming
yeah,
to their fellowship or out of their fellowship with all this credential. They don't need to have me sit and tell them this is about
yeah, yeah.
metabolic dysregulation due to diet.
And the other problem is that most of the education that we receive as trainees, it's mostly being scripted by industry.
Bingo. That was another point I wanted to make when you were talking about, I think you used a term diagnosis, or I was thinking the term diagnosis. That is an insurance-based conversation or language or
Yeah,
concept. So
yeah,
you go to your doctor because you're not feeling well, not because you want to feel optimized,
yeah,
but and that not feeling well gets a name so that the doctor can bill her or his time, and that diagnosis then becomes the thing that gets
yeah,
the treatment, which is
yeah,
in the case of the 13-year-old, the birth
yeah,
control pill.
yeah.
So it's a failed
Incidentally,
system.
I just want to put out there to the universe that I welcome any person who wants to feel optimal and wants to have optimal health. You do not have to wait for a breast cancer diagnosis to come see me.
Amen.
My
Amen.
doors are open for those people
Mhm.
that just want to live as long as possible, as well as possible.
Yeah.
I'm just putting it out there.
But
Yeah.
but the Smart Woman's Guide is probably a really good first step as well, because then you're
Yeah.
arming yourself with some really important knowledge so that by the time you're engaging in courses or memberships or so forth, you've got some juice in you as well to know what you're
Yeah.
doing.
And I
Mm-hmm.
just think it's an amazing foundation for people to start to understand how to build your health and maybe even prevent getting to any of those diagnoses, right?
That's the goal, right?
Yeah.
That's what we should be doing,
Yeah.
right? So
Yes,
those
absolutely.
diagnoses should
So,
be obsolete
yeah.
if we're doing everything properly. I don't want to say right, because it's not a right or wrong. Life is not right or wrong. But if we're engaging as best we can, then we're
Yeah.
going to minimize the likelihood that we're going to be sitting across the desk to receive that kind of diagnosis.
Yeah. And
But
it's not cookie cutter, right?
yeah.
So the same things are not going to be true for everyone. And I
Mhm.
know that everyone is walking a different path and everyone has a different journey. And there are a lot of people who have presumably done everything right and they still get a diagnosis.
Exactly.
And that's okay. This isn't about punishment. It's not about
Mhm.
blame or
Yeah.
shame.
It's not success or failure. It's
Mm-mm.
engagement and surrender.
Yeah.
Mhm.
And it's also about listening, messaging. What is this trying to tell you? I had an amazing conversation with Dr. Keisha Ewers last week.
Mhm.
And do you know her?
I
Do you
do
know Dr.
not.
Keisha?
Mm-mm.
Her brilliance just eclipses anything that I've heard recently. I just
Wow.
was so blown away
I'm going to
by
go take a
her.
listen.
Yeah,
Hmm.
she has infinite wisdom, which has come at the hand of many of life's challenges. Let's
Mm.
just say that.
Hmm.
And on her, I don't remember if it was her first or second breast cancer
Mm.
diagnosis. And this is someone who literally has done everything right,
Hmm.
seemingly done everything right,
Hmm.
and faces these tremendous life challenges.
Hmm.
And it was her first or second breast cancer diagnosis where she had to ask herself, what part of you wants to die?
Hmm.
Because that's where this diagnosis is coming from. That's where this development is coming from. That's
Mm.
where this disease, this dysfunction is coming from. And asking yourself, like, why? Why? What part of your light are you wanting to extinguish
Hmm.
and why? And she had to do some really deep soul searching, some deep trauma work.
Hmm.
She had to conjure up some memories that were so suppressed. And it came back to the time when, and she shares this story
Hmm.
openly, so I'm not speaking out of turn. She was being sexually abused in her own home And her mother did not believe her, did not support her. And she wanted to die to escape it.
Right.
And she buried all of those memories for many years until her own child was sexually abused.
Oh, my goodness.
And it was only when that happened that it all came back to her. And it was so painful for her that she wanted to die, because sometimes dying is easier than living. And it was all of that pain and trauma that she had to reconcile. And not all of us, listen, this is not a welcome opportunity, right? But she had the opportunity, even though her child had to suffer greatly, and she wishes desperately that it didn't have to happen this way. But she had the opportunity to parent through horrible tragedy in a way that she wishes her parent had parented through that horrible tragedy. And it was only when she relived that and gave it a different ending and a different experience that she was able to reverse her disease.
Beautiful. Tragic and beautiful.
Tragic and beautiful. And when you listen to her tell a story, and you can borrow some of her strength and lend it to your own story, and be brave enough
to
ask those questions and write your ending.
Yeah.
And that's what I say to people. So often we have to choose. Are we going to be an actor in our story, or are we going to be the author of our story? And it's not easy to author your story. It's not easy to take that active role. And so many people would prefer to just be the actor, because that's easy. Even if the consequences aren't easy, not taking that leading role is much easier.
It feels easier in the moment. But ironically, it's not, in my sort of experience, it's not easier, because doing so has a cost for our very purpose for being here. Like, we came into this world, into this body, into this representation of life to have an experience, to offer something. And if we are only being an actor in our own story, then we're forfeiting that very special privilege that we were given to come into this life and share ourselves and our wisdom and our brilliance and our sparkle.
Yep. Absolutely.
I could have this conversation for another hour, and I want to be respectful of your time and the listening viewers' time. But because a lot of these conversations at Health University and Your Fertile Health focus on the IVF person, and because with breast health, an IVF person is often asked to first go get her mammograms before she's being given the stims, because if there is an estrogen positive receptor site breast cancer activity, of course, that the doctor is, with all good intention, saying you should go get this exam. I want to hear I know I could, if you're only listening.
Am I drooling? Am I chomping at the bit?
If you're only listening, you're missing a really great image. So please do share your thoughts on that scenario.
Yeah. Because it's hard to rock my cage. Like, I was a surgeon for 20 some years. Like, I don't get rattled that often. But the second we start to have the mammogram conversation, my blood is boiling and I have steam coming out of my ears.
Thank you for sharing in our conversation here at Health University. One of the ways in which we help people improve their fertility is through our 5-element fertility quiz. Please click on the link below at yourfertilityquiz.com and take this short quiz. You'll receive a free report that includes easy-to-implement ideas to improve your whole health and your fertile health. Now let's return to our topic in today's episode.
So let me just say that when the mammographic screening program started in the 1970s, it really truly did start with the best of intentions. It was built on this foundational belief that breast cancer growth is both linear and predictable. And if you could find a breast cancer that started very small before it reached a critical size, at which time it was more likely to metastasize, if you could find it before it reached that critical mass, then you could save lives and save breasts. It's a lovely theory. Just doesn't happen to be true. Breast cancer growth is neither linear nor predictable. There are very aggressive processes that are aggressive from the moment they start, and it doesn't matter what size you find them, it's going to be an aggressive process. And there are processes that are not aggressive, and those, it almost doesn't matter what you do, because those people are going to do great, and everyone in between. And the problem is that we've known this for a very long time. And despite knowing this, and despite having evidence that shows that mammograms do not save lives, we have continued to run this mammographic screening program and grow this mammographic screening program. What's the problem with it? It's radiation. And if you asked 100 radiologists, does radiation cause cancer? They would all say yes, without question. We know it's a known carcinogen. It has been classified as a known carcinogen. Even the radiation oncologists, before they give radiation for anyone with cancer, they say, by the way, sign this waiver, because you need to know that radiation puts you at risk of a second malignancy, right? So this is known facts. And then you ask those same radiologists, do mammograms cause cancer? And what do they say? Resoundingly no. We somehow gave it a pretty name, gave it a better name. Let's not call it what it is. Let's not call it a breast x-ray, because when we talk about a chest x-ray, we all know those cause cancer. But we're going to call it a mammogram, and suddenly it doesn't cause cancer? It's preposterous.
It sounds like a delivery. Mammogram, telegram.
Cheerful, wonderful, amazing. It's going to
And
save
if anyone
lives.
has had one,
It's
you all know
like
that
the
there's
Donald
nothing
Trump
cheerful
of
about
things.
it.
It's amazing. It's going to save lives. It's going to, like, all of these big blustering promises. And yet, what's actually happening with mammograms? We're causing a minimum in this country, a minimum of 5,000 cancers a year. In addition to that, when you look at the incidence of breast cancer, the incidence of breast cancer was on a steady rise from, let's say, 1999 to 2012. And then that slope went like this.
Why?
Well, so what did we introduce into the system in 2012? The digital breast tomosynthesis, the 3D mammogram. We went from giving women a little bit of radiation after every year to 2 to 3 times more radiation. And when we brought digital breast tomosynthesis onto the scene, we promised that the callbacks would go down, but they didn't. So we're calling back the same number of women. And a callback means that you're having another set of mammograms. So now
Pretty
it's not 2 to 3
thereafter.
times.
So it's
a week after, a day after. So now we're taking that woman who is not just getting 2 to 3 times more radiation. Now she's getting 4 to 6 times more radiation. Sometimes if you have a dense breast or a large breast, and we have to increase the amount of radiation in order to penetrate the tissues, some of these women are getting 10 times the amount of radiation. So now we are taking women that may never have gotten breast cancer, and we're guaranteeing that's happening. So we are causing a significant amount of breast cancers. And beyond that, we are overdiagnosing and overtreating, because we are finding these breast cancers that are very small, that probably would never have become clinically relevant. And now we're condemning women to breast cancer treatment because once you diagnose it, it's
You've
a
got to
huge
treat it.
liability to not treat
Right.
it.
Yeah.
And we haven't made any attempt to figure out who needs treatment and who doesn't, because why would the system want to figure that out? The system makes a fortune on cancer care, especially for the woman that doesn't really need it.
Goodness gracious.
And we know that there is a large population of women who don't need breast cancer treatment, because when we look at the Swedish studies, we look at women who have equal access to care, and the care is exactly the same. It's not like these people couldn't get breast cancer care. It's not like they were getting lesser breast cancer care. They took two populations of women who have the exact same access to care. They screened one population and didn't screen the other. Survival is exactly the same. So
Wow.
they're not impacting the bottom line at all, but they treated a whole hell of a lot more breast cancers in the screening group.
Of course.
So there are a bunch of people getting treated that never needed treatment, and they're not saving lives. Now we can say, okay, but we are saving breasts by doing mammograms. We're saving breasts because we're finding smaller tumors, and so people are having lumpectomy instead of mastectomy. And isn't that a tremendous advantage? I guess maybe it would be a tremendous advantage if it were true.
Oh, wow.
But that's not what happens, because women are so consumed with fear
Right.
upon a breast cancer diagnosis that what are they doing? They're choosing to have a mastectomy.
Yeah.
They're afraid to keep their breast. What if I have another cancer? I don't want it to come back, right? And so they're choosing mastectomy. So we're not saving lives. We're not saving breasts. So what are we doing? We're costing women. That's who's being hurt, because the system's making a fortune. We're doing 37.5 million screening mammograms every single year. We are diagnosing upwards of 240 or 250,000 breast cancers every single year. But what we're not doing is impacting the bottom line. The same exact, no matter how many mammograms we do, the same exact number of women die of breast cancer every year. No matter how many mammograms we do, the same exact number of women present with aggressive disease. We are not impacting the bottom line. What we are is treating more people for breast cancer that don't need to be treated. And we're making no attempt to figure out who those people are.
So
until now.
what would you suggest for the person with I'll say woman, the person with breasts who wants to go through an IVF treatment, and the center needs to, for their own insurance, legal cover, you know what, put them through some kind of examination. What is her option?
Let me divide it up into pre-2024 and post-2024, right? So pre-2024, I would have said that your best option is to combine some kind of inflammatory screening test. I like thermography. And I do think that before we embark on a fertility journey, we should be knowing, where is your inflammation coming from? Where is your imbalance coming from? Where are your health challenges? What do we need to address in order to get you healthy? Because as fertility is health.
Fertility
And
is
if
health,
you're
pregnancy is
healthy,
health,
yeah,
the baby,
all of it.
all of it.
If you are not able to get pregnant outside of a physical obstruction of some sort, right? If you're not able to get pregnant, it's because our bodies are programmed to not bring a child into the world unless it's safe. And so that safety, is your body functioning optimally, or does your body feel like it's being chased by a saber-toothed tiger? So we have to get rid of the saber-toothed tigers first. So I like to do an inflammatory screen, and I do this for my breast cancer patients too, because as we spoke about, like, your patients are about 10 or 20 years behind my patients, but they're the same people. I like a full body thermography, but I want to be clear because thermography gets a very bad rap. Thermography is not a screening tool for breast cancer. It's not. That's not what it is. It's not what it's powered to do. It looks for a heat signal, which is associated with inflammation. Now, that's very valuable information. We just need to make sure we put it in the right category. It's not a screening tool for cancer. It is to find inflammation. And then I pair that in the pre-2024 world, I paired that with an ultrasound. Because to me, unless you have a lesion in your breast that is solid, that has abnormal characteristics, that is growing, I'm not doing anything about it. I'm not chasing things. Post 2024, we have technology. Was it Apple's tagline? We have an app for that.
Oh, I know.
I forget whose tagline that was. That was someone's tagline. We have an app for that. We have an app for that, and it's called QT imaging.
Yeah.
So this is FDA cleared technology. It is the first technology that has been FDA cleared to screen for breast cancer in 50 years. In 50 years, everything else was grandfathered in. It uses sound waves to create a three-dimensional true reconstruction of the breast, and it can do that because it collects 200,000 times more data points than MRI. Wow. 200,000 times more. Wow. It creates an image with 40 times the resolution of MRI, and all without pain, all without compression, all without radiation. Yeah. The most meaningful part of this technology is not what it can do in that kind of one-time screen way, but that if we find a lesion, we can bring someone back in 60 days, rescan them, and measure what's called a doubling time. We know that cancers have a doubling time of 100 days or less, and those are the lesions that need investigation, right? Yeah. Those are the ones that's going to be part of that 40,000 unless we do something about it, right? The rest of them, we say, see you in a year because we know that is not a clinically relevant lesion. So it works really well for the person that can say, okay, if you say no problem, I'll come back in a year. For that person that has to know, that needs to know, that cannot possibly get by without knowing exactly what that is, it's not going to save that person from getting a tissue biopsy. And if that happens, they have to go through the traditional route.
Right.
They have to, they'll have to go get a mammogram. That's not the callback,
right? That's not the callback conundrum. So they go for their first time down a more serious route, if you will, which would be appropriate if seemingly appropriate, especially before they start taking stim medications that will increase estrogen.
But I will say that I first want to be clear that estrogen does not cause breast cancer, and it doesn't even drive breast cancer. When we talk about the treatments for breast cancer, like in the premenopausal population, women are being given tamoxifen. That is a synthetic estrogen. Let's not confuse the things. Estrogen is not bad. Estrogen is good.
Estrogen is wonderful. But so estrogen does not cause cancer, of course. That being said, if someone has an estrogen positive receptor site cancer taking place, am I hearing you say that it doesn't matter if there's more estrogen in the body? But due to the states?
Probably not.
Interesting. Okay.
Probably not.
Mind blown. Okay.
So I don't know that we'll ever have that clinical trial done. For many years, how was metastatic breast cancer treated? With estrogen, with progesterone, right? So the problem came about because you cannot commercialize a molecule of nature, right? And so that's why they stopped using estrogen to treat. It's because it is a
It's not the
molecule of
same.
nature. Yeah.
Yeah. Yeah.
And so they needed to come up with some synthetic form, and they came up with tamoxifen, and it worked in the breast. Not so good for the uterus. But if they could capitalize on estrogen, then that's what they would have done. And that's where this whole crazy, like, Premarin versus bioidentical, that's where that war came from. It's because the pharmaceutical companies wanted to capitalize on estrogen and progesterone. So they made a synthetic and marketed a synthetic, and it worked really well for a really long time. And so I think we just need to be really careful about hormone positive cancer and what it means and what it is. And it is absolutely positively normal to have estrogen and progesterone receptors on your breast cells. It's normal.
Absolutely. Yeah, I
That's
hear you.
how they get the signaling that they get. And whether or not a cycle or two of hormone stim would have any effect on a breast cancer remains to be seen.
Okay.
But the more important question is what's going on in the body of
Back
that
to functional
person
medicine.
that is driving that process. And from my perspective, like, that's a workup that should already be happening, is figuring out why there is dysfunction, because it's the same dysfunction.
Yeah.
And it comes back to functional medicine.
Yeah.
So for me, like, I'm not thinking about what are the stem drugs going to do to the existing breast cancer. I'm thinking about, why does this person have infertility? Why does this person have an existing breast cancer? Let's figure that out. They're probably going to get pregnant on their own once
And
we
that does
figure it
happen a
out.
lot. It does happen a lot in my practice, where when we really help this person clean up her body
Yeah.
and her relationships and her mental health. I use the term emotional health because I'm not a mental health provider. She's gearing up to have an embryo transfer or have a retrieval, and oops, she can't make it because she's pregnant. That's such a common phenomenon.
Yeah.
That being said, I am not anti-IVF whatsoever. I am actually very grateful for its ability to help so many families come into existence.
Agreed.
And so I really, really, really
100,000% agreed with you.
And however, what we want is not just a positive pregnancy test, because if your whole point for IVF is to have a baby, guess what you want? A healthy baby, not just a positive pregnancy test. So back to this functional medicine point of view, and is important not just for good quality embryos, not just for a successful transfer, not just for a pregnancy, but for the real reason you're doing this is to have a healthy baby. And to be healthy for your baby.
Yeah. And also, where does your baby get the health from? And that's going to dictate the rest of their lives. And so we really want to make sure that starts from the very, very beginning. And if for the women who are thinking about fertility, and I hope that they're thinking about fertility in as early as possible, right? Because that should be all of our goals, is to have properly functioning bodies so that when you want to get pregnant, that happens easily and in a healthful way, so that you can have a healthy child from the start.
Yeah. And from the start, that means from your egg before it ovulates, from that sperm before it ejaculates.
Yeah, 100%. And I think that this is stuff that we should be teaching our kids, that this all matters, and it matters at every stage.
Yeah.
And we are in unprecedented times. We have 2 out of 3 kids are overweight or obese. 2 out of 3 kids.
Yeah, I hear you.
We are seeing diseases in our children that we never saw. I don't know about you, but when I was in medical school, we didn't see kids with lipid profiles that were like 60-year-old men. Every now and again, you would see a kid who was overweight, but now it's like the norm.
Yeah.
We're seeing kids with teenagers with type 2 diabetes. We didn't
Yes.
see this.
Yes.
It was unheard of. And to have 20 somethings have strokes, I didn't see that at all. And diseases that I would have said it's not possible, like pancreatic cancer in the 30s, unheard of.
And
And
not to, so that the listeners don't feel as though we've just given them, a prison sentence or a death sentence. All of this can be mitigated, reversed, and
yeah.
healed. And there almost doesn't matter what happened in the past because it's the past, but it's good data for knowing where to direct ourselves now. And we are right at the top of the hour. So I want to make sure before we wrap up, because I'm loving this conversation and I know that the listeners are as well, but I want to make sure that we don't miss any salient points, that when we say goodbye, that you don't go, but damn, I didn't get to I didn't get to share the one thing I came on to share.
I think that the main message for everyone is what we started off with, and that's breast health is health. Fertility is health. This is a journey. Health is not a destination. It's a journey. It's a constant journey. It should start early and be continued throughout your life. Your priorities will change, right? And the same things that make you healthy in your 20s and 30s may not work quite as well in your 40s and 50s. And there do need to be shifts along the way. But to your point, it's all possible. It's all possible. We just need to bring it into our conscious and make sure that we are thinking about it and that we make decisions every day that promote our health.
Yes,
I
and this
wrote my
idea of
book.
selfish. Let's redefine selfish.
Yeah, yeah.
Mhm.
And it's okay to put your health first, because when you don't, you can't do the work. And until I healed myself, had I not healed myself, I wouldn't have been able to help millions of women to reclaim their health, to restore their health, to get to the place where they want to be. And I wrote my book, The Smart Woman's Guide to Breast Cancer.
I love that cover.
Thank you. I wrote this. Of course, I want the woman with a breast cancer diagnosis to know what to do, to know where to turn, to know what questions they need to ask, to know how to build their team, and to know all of the things that they can do for themselves to build their health, right? But I also wrote this so that their sister read it, so that their mother read it, their best friend read it, their daughter read it, their cousin read it, because this is also how to prevent a diagnosis. This is also how to live your best life, because breast health is health. Because you're going to do the same things to make healthy breasts as you're going to do to make a healthy body.
Absolutely.
And the first Perfection Imaging will open in the Philadelphia suburbs in July. And then I have 7 behind it going up and down the East Coast. And I'm helping other people to open throughout the continental United States. This is going to be technology that, at least for the foreseeable future, will be in the United States only. I don't think that they have a lot of plans to go outside of the United States at the moment. I think they really want to establish this technology as the standard of care in the United States first, before it becomes technology that the world is going to use. If you live somewhere else, plenty of people come to the States to visit. And I'm on a mission to make sure that there are enough places for anyone who wants one of these scans to get imaged. The typical woman gets imaged once a year. If you have an absolutely positively normal scan, then you probably don't need a scan every year. You can probably go every other year. And I'm also going to be rolling out some technology that allows for real-time breast cancer risk analysis, so that if you need a scan every year, if you're high risk, if you're not high risk, that kind of thing. So there's going to be a lot of health building and health maintenance resources
Yeah.
available at each of the perfection imaging so that you can be the author of that story.
Beautiful.
Because for each of us, that's what's really important, is to make sure that this life has so many beautiful things to offer.
And you are one of those beautiful things. Every listener out there, and you, Dr. Jenn, as well. Yes, we tend to think of the beautiful things as being out there that we get to enjoy, and that is true. But you are one of those beautiful things. If you're listening to this, please know that to be true. Remind yourself of that because sometimes we forget.
Yeah.
Yeah.
Thank you.
Thank you so very much for
It's
joining
my
the
pleasure.
conversation today. And again, listeners, the show notes will have all the resources tucked in there so you can just go through it and see where is there one coming up in your neighborhood? If not, where can you go so that you can start to, take charge of your health, your breast health, and your whole health. Without further ado, we're going to call it a wrap. And what I often say at the end of the Health University podcast, class dismissed.
Thank you so much for having me.
Thank you.